Well, welcome everybody to the Australian Clinical Trials Alliance, or ACTA, Annual Summit, National Tribute and Awards. And this year has been a year like no other. And it's a year where we start by acknowledging the work of our medical leaders and our medical researchers as genuine national heroes. They really are national heroes. They've helped save lives and protect lives. Whether John Zalkberg, it's you and your team, or Simone Yendel and her work, you've helped bring together amazing Australians to achieve incredible outcomes. And through me to you, please pass on my thanks to everybody. We know our Australian outcomes, by comparison with the rest of the world, are extraordinary. The world has been through the hardest of years, and we've had our tragedy and our heartbreak in Australia. No country has been immune, but as we speak, Australia is on many days having zero or a handful of community transmission cases, and the world is facing over 500,000 cases a day. And this means that what we have done at home is extraordinary. It has saved lives and it has protected lives. And that's been a mixture of public health, public policy, and amazing medical leadership. As part of that, of course, there are clinical trials, and there's been over $360 million invested in medical research in Australia through the course of COVID-19. And that's been our task and our responsibility to be able to support the medical community. And we are on the path and the search for a vaccine, and Australia is playing its role in helping to lead that. But that isn't the end of the story. Clinical trials more broadly are fundamental to the health and protection of Australians. We have put together a $614 million medical research future fund clinical trials program for rare cancers and rare diseases, the largest such program in Australia's history, and given it a 10-year funding base, so to provide deep, profound certainty for the sector. At the same time, we've contributed to supporting ACTA's coordinating work with $5 million over the next 4 years, announced in September. But then as we look forward, there's a moment in history, an opportunity for Australia to be a beacon for the world in terms of clinical trials. In so many countries, it's not possible to be carrying on regular clinical trials. And yet it is in Australia. And so this moment builds on what we had already laid down together as a foundation. So as we go forward, there's $125 million for rural and remote clinical trials across Australia. That will help provide opportunity and save lives and protect lives for the most remote Australians, for people in rural Australia, regional Australia. And that's profoundly important, but it also provides the capacity, now working with the once-in-a-generation transformation of telehealth, to mean that all Australians have access to clinical trials, and that our national picture is stronger and more equal than it has ever been. But we can bring international trials to Australia as well. And so together, what we want to do is work with you on the one-stop shop, to think of it as the single approvals process as well as the recruitment process. We're vastly advanced on that, but we can achieve the national mutual recognition through this course. And that's something which will allow us to have single approvals, mutually recognised, supporting patients right across the country and allowing access. And this pathway will strengthen clinical trials still further in Australia. It's been designed by and it's been recommended by ACTA and those who are part of this conference today, part of this summit, and it's ours to work on together and to deliver. And that's our task over the course of the next 12 months. So John and Simone and everybody who's here at today's summit and tribute and awards, I want to thank you and honour you and wish you all the best for the coming year.